Hello, everybody. My name is Lewis, and today we're going to be discussing the different types of medical professionals that you may encounter during your stroke recovery journey, whether that be a survivor of stroke or as a care partner, and how these different medical professionals can assist you specifically in this journey. So, as always, I'm going to share my screen with you as we discuss the content. And so, as I kind of talked about just a little bit ago, we're just going to be going over medical professionals and the various types and how they can assist you specifically. I do want to emphasize, though, that this is not a comprehensive list. This is not all encompassing. There are many different medical professionals out there that can be beneficial for survivors of stroke and their care partners. So, this is just a general idea of medical professionals that can help in various different areas that you might need support in, kind of coming out of a stroke or even as you continue your journey of recovery years after. So again, this is not every single medical professional, but it is a good idea and indicator of maybe the supports that you can see out there. So to start us all out, we're going to start with occupational therapists. And these are individuals who are professionals and experts in modifying, adapting, and establishing valuable skills to improve daily life. So an occupational therapist is really focused on how are we going to be able to improve your ability to complete those daily tasks that you need to complete to carry out meaningful and purposeful life, and also just for daily living purposes. So they focus on areas what we call ADLs, which are activities of daily living. Those are things that you have to be doing on a daily basis. They also focus on leisure activities. They focus on activities such as toileting, dressing, bathing, feeding, grooming, any type of leisure skills you want to participate in, whether that be, golf, swimming, going out to eat, going out in the community. These are all things occupational therapists are trained to work in and help you navigate and adapt to following different types of conditions, such as a stroke or any other various conditions that could come following a stroke. So this is who you would see if you're wanting kind of help in those areas. So for example, let's say after a stroke, you're having a challenge with doing laundry. Well, then an occupational therapist would come and they would teach you either adaptive ways, they would show you different ways to complete laundry, they would provide you exercises and therapy to help strengthen your ability to do laundry on your own. They're kind of really helping train you and getting your body back to a place where you can continue to do these tasks and be as independent as possible. Now, they differ from a physical therapist who are professionals in restoring movement, improving function, and then decreasing your impaired mobility. So, a lot of the time, people get physical and occupational therapy kind of mixed up or kind of bunch them together. And that's common because there is a lot of overlap between the two. But many people think that only focuses only on the upper body, like shoulders, arms, and hands. And physical therapy focuses the lower body, so hips, knees, ankles, and that's just not true. Both therapists can bleed into each other areas. They're focusing on the body. It's just what they're wanting to do with the body that is different. So the best way I can explain this is that a physical therapist wants to help individuals get from point A to point B, whereas an occupational therapist wants to help individuals be able to do what they want to do at point A and be able to complete what they want to do at point B. So the OT is helping you do what you needed to do at each point, whereas the PT is helping you get from that point to the next, if that makes sense. So physical therapists are really focusing on your gait, your mobility, how are you walking, how are we going to increase the range of motion so that you can be safer in mobility? Are there types of equipment that you can use to increase your safety and ability to get around? That's all going to be physical therapists, a lot of strengthening and a lot of training. And then we go into speech language pathologists. And these are individuals who aid in improving your communication skills as well as cognition. So, communication, as regard to speech pathology, can bleed into a lot of different areas. That can be reading, writing, speaking, comprehension, all areas of communication that a speech language pathologist would focus on. And they can do that through vocal training, they can do that through using adaptive equipment such as technology to help communicate. They also focus on improving cognition, so working on a memory, attention, functioning, attentiveness. That's all things that a speech language pathologist is going to be able to benefit with. So if you're finding yourself having trouble with some cognition or memory, or you're having some speech difficulties, then a speech language pathologist is definitely a professional that you might want to go see. Next up is a neurologist. And these are individuals who are a special kind of doctor and they aid in specific treatment of the areas of your brain affected. So I like to think of a neurologist as just a sole doctor of the nervous system. And since we've talked about it earlier as stroke being a neurological condition, impact with the nervous system, a neurologist is going to have the information, the ideas, the knowledge, and the treatment plans to specifically provide you treatment in this journey of recovery. They can change treatment, they can adjust it based off of how you're doing and how your body's responding and how your brain and the nervous system's all interacting. So a neurologist is going to have that expertise to kind of help guide you through that area as well. And then you move on to a physiatrist, and these are individuals who are physicians that aid in coordinating recovery and pain management. So they're also a special type of doctor, a specialty, where they're very focused on the movement of our body and how you recover that movement and how do you manage pain as you go through these changes in movement. So I like to think of as like almost an umbrella in that you have occupational physical therapy, which are the therapeutic aspects, but then you have that kind of umbrella where physiatrist is the one above that kind of bleeds over into both of those, but also has that aspect of medication, different forms of holistic treatment they can provide, different kind of medical advice, expertise, and knowledge that maybe the therapists have in a different area that they can provide through a different lens. So having all three of those together is be very beneficial in helping restore movement or helping you use movement that you have presently in the best way, most functional way. Then we have a psychiatrist. And so these are another special type of doctor that aid with cognitive, emotional, and behavioral changes. So you want to see a psychiatrist potentially after a stroke if you are experiencing maybe depression, post-stroke anxiety, maybe if individuals are living with pseudobulbar effect, potentially having different emotional changes or behavior changes. A psychiatrist is trained in understanding how to navigate this with medication, with treatment, with psychotherapy, and specifically seeing a neuropsychiatrist, which is even a deeper subspecialty of psychiatry. A neuropsychiatrist, as opposed to just a general psychiatrist, specifically focuses on that neuro element as well. And so they would understand the idea of with stroke recovery that our brains might be impacted in a specific way. So how do they navigate that with their medication, their psychotherapy and treatment? They're taking that all into consideration when providing treatment. Then next would be a nurse. Nurses are kind of the frontline workers of healthcare. They can provide education, help with medication management, and they can also assist individuals with their immediate needs. So seeing a nurse specifically and having a relationship with a nurse can help also open a lot of doors to other professionals because the nurses who you're probably going to see the most often when you're either in the hospital or even post recovery, you can speak with nurses and ask for, information on therapists or information on physicians, and they can kind of educate you on, anything with these medications, are there any changes, assistance with basic things. And so having a nurse there as kind of your mouthpiece and to kind of help support you and advocate for your needs, but also provide you that assistance and that medical expertise and knowledge is very beneficial as well. And then next we have social work and case management. And these are individuals who assist in the discharge process and locating community resources. So these are individuals that are going to help find those resources in the community that might be beneficial to you in your journey of recovery. So they'd be able to find you, the Ability KCs, the American Stroke Foundations, those types of settings that can kind of help provide continued care for you and your loved ones. They can also provide, resources for care partners as well. So social workers are going to have a lot of that information, and so they're going to be able to provide a lot of support in those types of areas. All right, and so this again is just kind of a general list of the medical professionals that can help with recovery post-stroke. But again, this is not an all-encompassing list, so just keep that in mind as you kind of navigate this. But this is a good place to start, and I hope that you guys got something out of this that you're able to take with you either to tell somebody else or just take with you to kind of take that information and sit on it and hopefully make things easier for you and your survivor. All right, I'll see you guys next time.